evening, colleagues. Thank you for the opportunity to present SB 874. I will be accepting the committee amendments described in the committee analysis that will be taken next week during Senate Public Safety. SB 874 strengthens oversight and standardization of behavioral health treatment for services in Medi-Cal. Behavioral health treatment services include applied behavioral analysis, commonly referred to as ABA treatment, and other behavioral interventions that prevent or reduce behaviors that interfere with learning and social interaction, most commonly for individuals diagnosed with autism. Recently, utilization of ABA services has grown significantly in both Medi-Cal and the commercial market here in California and across the nation. Some of this growth is by design, as the legislature has passed many bills to reduce barriers in families that faced accessing ABA services, and to ensure that children can access behavioral health treatment early when it can be most beneficial. However, as a result, a referral for behavioral health treatment services is simpler than any referral for many other Medi-Cal specialty services, and many of these providers do not have the same licensing requirements as for other Medi-Cal services. At the same time, there have been several media reports documenting ABA services that were overcharged or overprescribed, and at least one ABA provider in California has been charged with false billing and settled. Additionally, at the beginning of 2022, the Federal Office of Inspector General initiated audits of Medicaid payment services for ABA in several states. In 4 states reviewed to date, audits identified significant improper payments and compliance issues resulting in substantial repayment obligations. Prior to introducing this bill, I had in fact considered requesting an audit of the program. However, an audit reviews largely for compliance. The real issue is whether the benefit itself needs additional parameters or guidance to ensure that children who need the benefit are the ones who get it, and that families aren't unwittingly signed up for more hours than necessary. Furthermore, we must prevent services from being delivered by paraprofessionals who, without adequate supervision and who are not even required by statute to be fingerprinted, despite their work with children. SB 874 requires DHCS to take the following actions to evaluate and improve Medi-Cal's behavioral health treatment services by requiring background checks for BHT providers who are not already subject to fingerprinting during licensing, convening a stakeholder work group to advise on standards for BHT services, issue and maintain clear clinical guidance for BHT service based on stakeholder input and federal guidance, and report to the legislature on BHT utilization and recommendation to improve program integrity and compliance. Back in 2014, when these services were first added to Medi-Cal, there were very few providers and much less awareness of services available. The services and the field have changed significantly since, so now is a good time to conduct a thorough review. I respectfully ask for an aye vote, and with me today is Liz Kumar from the California Association for Behavior Analysis and Katie Andrew from the Local Health Plans of California. Thank you.
Thank you. Go ahead and proceed when ready, and you guys have 2 minutes each.
Okay, thank you. Good afternoon, Chair and members. My name is Liz Kumar, and I am a board-certified behavior analyst, and I serve on the board of directors for CalABA, or the California Association for Behavior Analysis. For over a decade working and consulting with behavioral health providers across California, I hear from many providers who are reluctant to accept Medi-Cal families. And this is not because they don't want to serve those families. It's because the system has become so complex and inconsistent that it's just not viable. Each managed care plan has its own rules, its own forms, its own timelines. And for providers who do participate, credentialing alone can take over 200 days. That's 200 days that a family is waiting while their child goes without care. That is the problem that SB 874 begins to solve. This bill creates a deliberate, multi-stakeholder process to evaluate how behavioral health treatments like applied behavior analysis are implemented within the Medi-Cal program. and it's looking specifically at credentialing, documentation, and authorization requirements. It brings together providers, plans, and consumers to make recommendations that are grounded in clinical reality and not just administrative convenience. And it does this without making abrupt changes that could disrupt access to care. And it even strengthens consumer protection by requiring those background checks for unlicensed providers, which is a practical step given just how much of the behavioral health workforce operates without licensure. This process creates a thoughtful pathway to consider long-term solutions, including potential licensure frameworks, in a way that is data-driven and doesn't disrupt the existing workforce or access to care. CalABA looks forward to actively participating in this process to help ensure the resulting policies reduce administrative burden, reflect evidence-based standards, and expand access to high-quality care for Medi-Cal benefits. SB 874 gives California a real framework to fix a system that's currently pushing providers out and leaving families behind. We respectfully ask for your aye vote. Thank you.
On a birthday vote. Thank you, Matt. Thank you. Go ahead, please proceed when ready.
Thank you. Good afternoon, Chair and committee members. My name is Katie Andrew, and I'm with the Local Health Plans of California. LHPC represents all 17 local community-based Medi-Cal plans serving over 9 million Californians. We are proud to support SB 874 because it advances important safeguards in the delivery of behavioral health treatment services for vulnerable children in the Medi-Cal program. SB 874 takes meaningful steps to strengthen program integrity by convening a stakeholder work group to inform clear statewide guidance on how BHT services should be delivered. Today, variation in standards can create confusion for providers and inconsistencies in care. SB 874 helps us move toward a more coordinated, accountable system. Just as importantly, SB 874 comes at a time of heightened federal scrutiny of Medicaid programs, making it critical that California demonstrate strong oversight, consistent standards, and accountability in how services are delivered and documented. We want to thank the chair and your staff for the amendments reflected in the analysis, also which we feel is critical to ensuring patient safety while avoiding duplication, inconsistent standards, and unnecessary administrative burden across plans and providers. We appreciate the author's leadership in advancing efforts to ensure the safety of children in the Medi-Cal program who need BHT supports and ensure a more consistent and accountable delivery of the BHT benefit. For these reasons, LHPC is in support of SB 874 and respectfully urge your aye vote in favor of the bill. Thank you.
Thank you both for your testimony. This is a time for witnesses to come forward and state their support. Just name organization and position, please.
Thank you. Cassidy Heckman on behalf of the California Association of Health Plans in strong support.
Thank you. Anyone else? Those in opposition, if there's lead witnesses in opposition? Thank you. Please proceed. You have 2 minutes.
5 minutes?
2 minutes.
I was informed I would have 5 minutes since I'm the only one here for
Can I
opposition.
defer to staff on this committee? Sorry. Typical? Yes. Okay.
You hold the gavel, so you decide.
Okay. So I gave them each 2 minutes each, so I'll give you 4 minutes since you're by yourself.
Thank you.
Thank you.
Chair Weber Pearson and members of the committee, for the record, I am submitting appendices A through E, 110 pages, which your office confirmed this morning. You all have this packet. These materials were also transmitted to the United States Health and Human Services Office of Inspector General and CMS, and you are hereby served. My name is Dr. Henny K. I'm an autistic policy analyst, and I am with the Dugarry Institute. We are here to oppose Senate Bill 874 unless amended. Our effort did not start here today. We, the autistic patients, identified patterns in Medi-Cal's behavioral health system. We saw what was happening to us and to our autistic children who were harmed from applied behavior analysis. ABA is not a health benefit. It is a human rights violation. We documented it. We submitted our findings. We proposed fixes. We asked to meet. We were told bring forward legislation, and we did. In your appendices, you will see the corrective action plans with the recommendation for audits, which you chose not to complete. And so in the next appendix, we completed the audit for you. Then we were told that this work group will not be structured as we proposed in the legislative section of our packet. That is why I am here today, because Senate Bill 874 creates a work group that includes parties with financial stakes in the outcome. That is asking the foxes to guard the hen house. Because if the state cannot demonstrate program integrity, federal financial participation can and will be deferred. I have succeeded in 4 states, and I will not stop. I assure you, the Washington Post was very interested in our audit and cited our keywords specifically, that ABA is nothing but glorified childcare, and California lawmakers are underwriting with a blank check a human rights violation. As an autistic consumer of public programs, my survival depends on Medicaid. Without it, I will face institutionalization as I had before. This bill does not protect patients. It protects a system already under federal scrutiny. I would like to remind you that applied behavior analysis is conversion therapy. It targets autistic presentation. If I do not wish to make eye contact or am incapable of making eye contact, I am recommended behavior modification treatment to make my behavior present in a performative manner so that you can feel more comfortable around me. That is not a health benefit. In 2018, I published research by surveying 460 individuals who were exposed to applied behavior analysis. 86% had documented severe PTSD, not just average PTSD. Being exposed to 20 to 40 hours a week from when you are a very young child, even before you are diagnosed, to behavior modification treatment is no different than conversion therapy, which targets a behavior that you are born with, and it isn't a problem unless you are forced to integrate in a society that finds your very existence to be a problem. We are not a disease. We are a group of human beings, and each and every one of you now, thanks to the high prevalence, has a loved one with autism, and there is an autistic person in every cul-de-sac. We have not asked to be modified. We have not asked to be monetized. We don't want this industry to continue. We have asked you to please make sure to remove these offensive CPT codes from the state plan, and this bill needs to die.
Thank you for your comments. I apologize for interrupting you, but we allowed you 4 minutes, but thank you for your comments. Is there any other individuals in opposition to the bill? Please come forward to the mic. State your name, organization. Seeing none, I'll bring it back to the dais. Senator Padilla moves the bill. Senator Gonzalez.
Thank you, Madam Chair. Just to acknowledge the opposition, Dr. Weber, can you just acknowledge perhaps what she's stating and clarify and just give us a little bit of insight on what, if anything, you can respond to, because I do appreciate the witness for being here. You're very articulate. Thank you.
So, from my understanding, from what I'm gathering, her concern is with the actual therapy itself, which is something that is allowed from a federal Medicaid standpoint. What this bill doesn't refer to that. It just notes that we have some issues within our system. We need to tighten it up. We need to evaluate for better and more streamlined process procedures, making sure that those who receive this therapy that the federal government has said is fine are actually those that need it, and to make sure that those who are with our kids are actually, if not licensed, actually have a background check.
Thank you.
Thank you.
Sorry, thank you, Senator Gonzalez. Senator Caballero.
So let me ask this because I was very impressed with your testimony. It's not the first objection that I've heard in regards to this, and I guess I'm trying to figure out. You're trying to set a structure around something that we get money from the federal government to manage, and what's the process if it ends up that and I don't have enough information on the therapy to know the description of the therapy is very similar to conversion therapy, and I have not supported conversion therapy in any of its forms, and so I'm trying to figure out there's process, and then there's got to be a way to be able to go back in another bill and say this is a therapy we shouldn't be even allowing in the state, because conversion therapy we've already said.
I don't know if everyone would agree with that analogy.
I understand,
right?
Yeah.
And
right.
So I wouldn't go that far as to say that it's like conversion therapy. However, we do have someone who can probably speak a little bit more to that, so I will turn it over to my witness.
Great.
All right. Thank you. Yes, I am a board-certified behavior analyst trained in applied behavior analysis. And I first would want to acknowledge the opposition's statement. The field of behavior analysis has had a long and controversial history. The field now is moving and has moved towards listening to those who have come forward to say that they've had these poor experiences. I myself have seen evolution within the field itself to no longer do things like eye contact training and things like that. So I would not categorize it as conversion therapy in its current form, but we are a field that is providing services to people with autism and intellectual disabilities and by people with autism and intellectual disabilities. Many of my colleagues are on the spectrum. They themselves have received ABA treatment in the past, and the field itself is working towards being more compassionate and listening to our autistic consumers. And I think that is in the bill as well, to make sure that it's not just the providers calling the shots. It's the consumers themselves, providers, the Medi-Cal plans as well. We're working together to come up with these guidelines.
So it does the working together include individuals that are autistic as part of a conversation?
I believe so, yes.
Yes.
Okay, well, the witness says no, but then there's a yes. And so here's what I'm trying to get to. I really appreciate this because I've had conversations with in-home support care workers that have autistic children and feel like they can't get any services and they don't know how to help them, and or they take care of another person's child and they need help and services. And so I was struggling with what's the solution here which is a different conversation. But if I understand this bill, so there's work to be done. I guess that's what I'm saying, is there's work to be done. But what the bill is trying to do is to ensure that we don't have welfare fraud. And if that's the case, I think we need to do everything we can to ensure that, well, let me just rephrase it. It's that people aren't getting welfare, or they're not welfare. Sorry, I'm in Medi-Cal. It's late. I'm hungry. That there's not fraud in the system, paying for people to do things that aren't doing services they're not receiving. And so, am I right, or do I have it?
Yes, you are correct. That basically ensuring that those who need services are receiving the services that they need, and those that do not need these kind of services are not getting these services, or providers billing for these kind of services for individuals that don't need it. Additionally, having individuals providing some of these services who are not licensed and not being supervised is very problematic for me, and that's why there's a background portion. And I also want to state that in the bill amendments, when they talk about the stakeholder group, the work group shall include the following: consumers with autism and consumer advocates for organizations led by individuals with autism and organizations serving families of autistic children. So they will have a voice at the table, actually multiple voices at the table with this convening state group, work group.
Thank you for that. I appreciate it. I just needed to understand it, and I think there is work to be done. Let me just say that. I appreciate this discussion. Thank you very much. And thank you for being here, because I think you raised some really, really important issues. And it's a question of making sure that the door is open so you have a seat at the table, and that there are opportunities to have conversations about what's appropriate and what's not, and what is treatment that is assisting both caretakers as well as children themselves. So thank you for bringing this forward. I appreciate it.
Senator Durazo?
Yeah, I just want to reiterate or reconfirm what my colleague just said. I appreciate when someone has a different point of view, and how important that is to keep our system functioning at the highest standards, at the highest levels. And so you need to be commended for coming here and raising the issues. And the author of this legislation, this bill, has included involvement of the autistic community in this process. So whatever you can do, Senator, that strengthens that even more, I think would be a benefit to all of us. Thank you.
Thank you.
Thank you. Any other comments, questions? So I'll start. Thank you for being here. You brought up some very relevant points, and you appear to have, I haven't read the entire document, but we did receive it, and you appear to have done your research and got your background. The author said that they're specific on the panel, or the community group that's going to work with this, that there are 3 or 4 positions for autistic families, and every time someone says that, you shake your head no. So I'm going to give you the opportunity to respond and explain why you think that, with the language in there that specifically says they are including that, why do you feel that it's not so?
We drafted this bill. We drafted the language for this bill, and it is in the corrective action plan in one of your appendices. In that particular bill, we specifically stated that it should be autistic people who have technical expertise in conducting these integrity oversight mechanisms and investigating policy and analysis, not persons with autism who are being tokenized to give free emotional labor so you can all pat yourself on the back. I am not a person with autism. I'm an autistic professional and subject matter expert. So there is nothing in the amendment at this time that includes me. It's expanding to make sure that the industry continues to self-regulate itself, pat themselves on the back and say, oh, and we brought our affected patient group to the table. I'm here as a professional and a subject matter expert. I'm not here because I'm a person with autism. I'm affected by this particular very high risk, federally identified high risk volatile treatment that has been completely leading to Trump froze all of the funding in Minnesota because of what started in an autism clinic. We reported that to the feds first. And California doesn't have a mechanism to which we can investigate consumer feedback, as Minnesota didn't have a mechanism to investigate kickback schemes and other Ponzi-like structures which are identified in this particular report.
Thank you. Thank you. To the author, did you want to respond, or do you have a response, or to your witnesses? I'll take it from anyone.
No, all that I will say is that, like any work group that we create, it is a broad coalition of individuals, those who are impacted, those who represent, and those who are family members, and that is what this work group also has.
Okay, thank you. Any other comments? Do I have a yes? No. Do I have a motion? You did. Sorry. Senator Padilla moved the bill. Secretary, please call the roll. Oh, I'm sorry. Would you like to close? I'm sorry.
No, I know.
I'm a Republican. We don't chair very often.
No.
Senator, would you like to close?
Yes.
I apologize.
No. It's fine. It's fine. Want to thank all of those who came out to speak today, those who spoke in support, and for the witness who came in to speak in opposition. And to be fair, if it were not for her, I would not be here with this bill. She was the one who contacted the Health Committee and provided this information, and has been in constant communication with Health Committee staff about some of the issues in this particular area. And so it was the things that she brought forward that made me say we needed to move on this. Not necessarily wait on an audit, because we know that audits can take a very long time. And some of the things that I was finding out about because of her work, I felt needed to be moved on a little quicker. So really want to appreciate that, our staff, and with that, request an I vote on SB 874.
Thank you. Madam Secretary, please call the roll.
The motion is do pass and re-refer to the Committee on Public Safety. Senators Weber Pearson.
Aye.
Weber Pearson, aye. Valladares. Caballero. Caballero, aye. Durazo. Durazo, aye. Gonzalez. Gonzalez, aye. Grove. Menjivar. Padilla. Padilla, aye. Perez. Rubio. Aye. Rubio, aye. Smallwood Cuevas. Smallwood Cuevas, aye.
That bill has 7-0. It is on call. Thank you all for your testimony. Yes, Matt. Senator Weber Pearson, you can also address item 13,